Once again, a very good evening, ladies and gentlemen. It's a treat for my eyes as I stand here and see such a large gathering who have come here for a common purpose and a cause. The best of the talent across the country is sitting right here in this room, eager to conquer the burden of cancer.
Healthcare is undergoing tremendous evolution and tremendous development. We have clinical skills, we have subspecialties, we have super specialties, and we have clinicians today who are acquiring more and more skills, and coupled with the kind of technology which is available today, they are able to treat several conditions. They are able to treat and diagnose very many conditions which we never knew of in the past. And there is a lot of activity which is happening both in the preventive space as well as in the curative and then subsequent rehabilitation of patients. We also live in an age of information technology. There is an overflow of information, and hence the community's awareness about disease is extremely high. So it's a good situation to be in, where there's an aware patient, there's an aware community, which comes to the healthcare team to seek treatment, and thanks to all the development in healthcare, we are able to treat patients. So the story till some time back was every healthcare individual was rather perturbed with the diseases of the heart. If it was cardiac and cardiology, which was the major source of concern for all healthcare providers, I think I wouldn't be wrong in saying cardiac has moved over, and today we are in a situation where the disease burden in the community is more and more of oncology. So the need of healthcare today is to look at various aspects on how do we tackle oncology, what should be our approach to rid community or treat community of its oncology burden. The best way to decide on all of this is when there is a coming together of minds, senior minds, clinical minds, and the people from healthcare, people from industry, and people who make drugs. All of them, when they come together, the providers, both in the public and the private healthcare space, when they come together, put their minds together, and then come up with a strategy, that is the best way for us to tackle a situation which is today hurting the community. So towards this end, Fortis Healthcare and we at Fortis Mulund decided that we should work not only in the space of treating patients, but take a little time out to understand how to go about the preventive and understanding the entire onco-surgery and the balance of treatment. So we have this panel discussion today, and we have these eminent personalities. I'm not going to keep you from the discussion. So moving on, inviting you all again, and thank you all for coming for this wonderful discussion this evening. Thank you.
Good evening. Ladies and gentlemen, thank you very much for coming here, and thank you for sharing these and participating in this thought process of making cancer care decades. He has been conferred for his scientific and academic career with various awards, including Padma Shri, Lal Bahadur Shastri Award in 2013, and most of all, I am testimony to the fact he's a very passionate teacher and helps to spread the knowledge of cancer to one and all who come in touch with him. I welcome Dr. Badwe and request Dr. Narayani, Zonal Director, Fortis Hospital, Mulund and Kalyan, to welcome him with a bouquet. Dr. Narayani, please. For sparing your valuable time. And I must mention here that he agreed to this within a very short notice. We as lay people think of celebrities as always people who keep people waiting, delaying programs, but it is really very, very appreciable of you to have come absolutely on time and on a short notice just because he believes in the cause. I would request Mrs. Rinku Mavani, Marketing Head, Fortis Mulund, to welcome Mr. Hashmi with a bouquet of flowers.
I would like to invite Mr. Manoj Nair, Assistant Editor, Hindustan Times, one of the leading newspaper in India. He is covering corporate news stories. His experience in journalism has been over a period of more than 10 years and has been associated with the Hindustan Times since the last more than 2 decades. He was previously working with Times of India also, and he's very well known for his engaging style of journalism. I would like to request Mrs. Rinku Mawani, our marketing head, to please welcome Mr. Manoj Nair with a bouquet. Mrs. Rinku Mawani.
Last but not the least, I would have been a pillar of support for this entire meeting and has been very encouraging in this entire endeavor. He's a CEO who believes that his most important job is to be a facilitator who provides all support to the clinicians and nurses to deliver excellent patient care. He's an acknowledged business leader and a seasoned person in healthcare with over 25 years of experience. I would request Dr. Narayani, Zonal Director, Fortis Hospital, to welcome him with a bouquet. As I start the panel discussion, I would first like to ask Dr. Badwe sir about why is cancer now becoming one of the most talked about diseases in the country today?
I guess there are 2 or 3 reasons. Let me tell you what is not the reason. What is not the reason is that there is no increase in the incidence of cancer in India, and which is the biggest achievement of this country. There are 4 other countries that come in line, the famous BRIC countries, where the economy is on the rise, whether it's Brazil, Russia, or China, and India is one of those 4 countries. And cancer incidence in all these 3 countries, other than India, it's risen by anywhere from 12 to 24%, whereas that in India has been a straight line. The incidence has remained constant. Then why is the perception that it is more? And the perception is more because of 2 reasons. One is urbanization does increase the incidence of cancer, the numbers, the absolute numbers increase. And urbanization is happening everywhere, so the absolute numbers will increase, but so is our population. So the denominator increases, the numerator also increases, and the net incidence remains a constant. The second important thing, whether we should be happy about the second reason, that the amount of money at the ground level has increased remarkably. That has allowed individuals to seek treatment on various for cancer. And the third reason is that the absolute percentage of curable cancers have increased by almost 50 to 60%, whereas the incidence of incurable cancers is going down remarkably in the last decade or so. So there are a lot more people who are walking on the streets of India cured of cancer. There is no more taboo that I have cancer or I don't have cancer, which makes it that there are a lot more people talk about it.
Yeah, very well said, sir. The prevalence of cancer is quite high in India, and it is rapidly increasing, around 70 to 90 per lakh. Every year we are seeing an annual incidence, I will not say prevalence. Avinash sir, I have one question for you. What is your perspective on the cancer load in Mumbai and the ability of the municipal hospitals to deal with it?
Actually, if you see, the cancer is increasing in numbers.
Yes.
If you say it was about, say, 10 years ago in India, it was, say, 8 lakhs. Now it is, say, 1.2 new cases coming up. That means it is increasing, no doubt about that. But in Mumbai, we always get 2 types of cases. People who are staying in Mumbai and people coming from outside. And the outside load is tremendous.
Yeah.
Now in municipal hospitals, if you see, their hands are studded with many other things. From, say, dengue to lepto to even any other benign diseases. But still, a department like, say, general surgery or our GI surgery, many other departments, so most 30% of patients will have cancers. And what Dr. Rajan said is absolutely true, we are now seeing many patients which are curable kind of a thing. I mean, once upon a time, if somebody has a leukemia, we used to say, okay, he's gone. Today it is not so. A young child of leukemia can have almost reasonably 90% cure in many cases. So I think we are changing the type of patients coming to us. So even public hospitals also are changing towards. And as I said, 30% of our load is cancer load.
Yes.
And that is what municipal hospitals scope up.
Mr. Bhavdeep Singh, as a private sector hospital and a healthcare provider, do you think the private sector has yet to build capacity cases that we are seeing?
See, I think the discussion that's been taking place in India for quite some time, if you just step back for a second, we have challenges on multiple healthcare fronts. You heard Dr. Narayani mention a few minutes ago about the fact that for quite some time, for many years, the only thing we talked about was cardiac and the challenges that heart disease represented. So I think the short answer to your question is that I don't think that whether it's the private sector or the public sector, that we are prepared for the challenges that oncology presents. From a clinical perspective, from the number of doctors we have, from an infrastructure perspective, with respect to where we are, how many treatment centers do we have, the reality is we're not prepared. I'll tell you, so that was our first formal foray into oncology and treatment. Today we operate 5 such centers. Now the reality is that, if you just look at it in a narrow window, you say that's pretty good. It's not enough. It's not enough. We all read the headlines 4 or 5 weeks ago, and Dr. Saab just mentioned the fact that when you look at a numerator and denominator as a percentage, it's flat. But the reality is 1.5 million people are being diagnosed with cancer. New patients. So the diagnosis is going up quite substantially. So I think we have a lot to do. I think we have a lot to do from an education perspective, from an awareness perspective, from a treatment perspective, and we'll have to invest in it. And Fortis Healthcare being a large healthcare provider, we take that responsibility very seriously. And I think whether it's private, whether it's public, I said across the board, I think we all have to understand that we've started, but there's a long journey yet ahead. Yes.
I think as you talked about education, I would like to just state one thing. We were just discussing in our Hepatobiliary Pancreatic Association that in India we get around 30,000 pancreatic cancers every year, out of which only 20% are operable when they are, most of the time, when you look at them. 80% come to us still in an inoperable stage. That means we get 6,000 patients.
With cancer, with this brush with cancer and the book, yes, which was so nicely written. What is now the difference you observe when you were not, when cancer was something distant and now when it is something when you have experienced personally?
Well, first of all, good evening, everyone here. Thank you so much for inviting me. First of all, I want to, for people who have not read the book or don't know about my son's cancer, I'll give you a bit of a lowdown on what happened in 2014. My son was at that time 3 years, 10 months, and he was diagnosed with a condition called Wilms tumor. It's a very rare case of kidney cancer. It happens to a very small percentage of kids worldwide. And my son happened to be part of the unfortunate percentage of kids. This discovery of this cancer, the first very bizarre symptoms were over a very usual brunch at a 5-star restaurant in Mumbai when we had come back from a New Year trip in January. And there was no accompanying fever, there was no vomiting, there was no discomfort that my son had. He was extremely, he's a very, very positive, very, very energetic kid. And that day he happened to pass blood in his urine. And we as parents obviously freaked out. We took him to the nearest hospital. That's where we all get treated. That's in Khar, Hinduja. And his pediatrician, Dr. Ajit there, did the tests. And we found a 9-centimeter tumor that was growing on top of his left kidney. And, for any parent, and I'll speak for ourselves, for me and my wife, when we heard the news, it's like the ground beneath our feet had been ripped off. Cancer, the perception of cancer for a layperson like me, and I consider myself as a layperson because with education, with even staying in Mumbai, you've heard of people get cancer, but you don't actually go to the depths of it unless you have someone close to you diagnosed with the disease. My perception of cancer was this monster that is going to take my son's life. Because of a lot of things, maybe the way it's been projected in the media, maybe just the general vibe of what cancer has done worldwide. It has overtaken heart disease over the past decade. It's very prevalent in our country, in rural and because of urbanization in most of the places. And you're constantly hearing about deaths related to cancer. And that was my, prime fear at that point of time, that this is going to take my son's life. The perception changed when I started informing myself, when I started reading up a lot about cancer and demystifying a lot of things about this dreaded disease. I realized that 70 to almost 95%, in my son's case, the prognosis is extremely good. Wilms tumor is one of the best prognosis as far as cancer goes. It's highly treatable, and that was very heartening for me to know. But there was a revelation that happened over the course of 2 months after reading. So I had an agonizing 2 months. And, but still, it really took the life out of us when we heard the news. There's no way of encompassing that in words or trying to explain what a parent goes through. It's worse than being confronted with your own mortality, hearing that your 3-year-old son has got cancer. And our lives have changed ever since. We've started living a very new kind of normal. You make peace with the cancer in a way. It's this factor in the house. It's there in conversations that wasn't there. You can't wish it away. And your perception changes, and then you have to fight the good fight against this disease and make sure you don't let it get the better of you or your family. And that's exactly what we did.
Yeah, Emraan, and I think I just read through the book, and you have constantly mentioned a positive message there. I mean, Superman...
we use the analogy of superheroes in the book.
So I think, do you wish that in some ways the media should, or the general public, should have more positive news coming out? Because as I always tell my patients, a lot of times, people proudly say that I've got an angioplasty done at a 7-star hospital. But nobody says that I've got cancer treated at an XYZ place. So do you think that kind of positive news should come out? More people
I just wish positive news sold as much as bad news did. That's the unfortunate part. But yes, I mean, there's also projections in the media that bring about positive effects of cancer, but there's no running away from the fact that it is the major killer worldwide today. So there is this dread that, there is this underlying feeling that what if, and another reason is when you have something like a diabetes or a heart, you deal with it, you have terms that you are constantly have been thrown towards you, which is 5-year survival. Your fight doesn't end after your chemotherapy or radiation. It is another psychological problem you go through for 5 years. We're still dealing with it. My son is on 2.5 years now, which is, he's out of the red right now. But there are a lot of factors with cancer that actually add up the fear syndrome that we all have when we hear about cancer.
So Manoj, I think that's a message that probably I think we should carry, that media needs some good news as well as bad news.
Media doesn't look at news as good news or bad news. Media looks at news as news. So it's a very subjective thing. One day, negative news would be news. Another day, positive news would be news. So that changes. So there's never a similar day. I mean, it changes.
Just kidding.
No, I think what Emraan had told is very right. We see our patients, it's not they are the bravest in the world. I always say, Dr. Badwe will always agree, and even Dr. Harul, when we see our patient, they are the bravest. I think the most important point which you had been telling now is the family. And family is the main cornerstone for treatment and everything. I agree with your point, the one which you had very nicely said about this 5-year survival thing, which is always keeping the things in mind.
5 saal jiyenge. That's what people say.
Okay. So we'll come to the other question for Dr. Supe. Avinash sir, what are the challenges as far as when we look at cancer detections are concerned, especially in BMC hospital where there are less number of super specialists and more number of general physicians and surgeons looking at a patient?
I think because of the load of the patients who really come, what is most important for routine cancers, if they come which are previously diagnosed or they are overt kind of symptoms, I'm sure they're all picked up very easily. But when you start screening or when you start talking about picking up patients with alarming symptoms, there I think sometimes you find these are missed. And therefore, many times the investigations need to be much more in a place which is to be done. Of course, it's not that if they come to the major hospitals, usually they are picked up very quickly. Sometimes when they go to the health post or dispensaries or peripheral hospitals, sometimes there is a challenge. And because there are many times not specialists which are there, they are mainly MBBS doctors and sometimes they may be missing. And that's also a huge load. For example, the corporation has an OPD of something like huge OPD. It's almost an yearly OPD of 1.5 crores. And out of which the public hospitals...
A person in the family is diagnosed with cancer. So what do you think is this impact on the life of a family once a cancer is diagnosed? As regards the cost, as regards the anxiety, how does the healthcare worker, sort of reduce this? What would you like to see the healthcare worker doing to reduce this?
Well, first of all, I'd like to speak personally about our experience and the psychological impact of, our son being diagnosed with this cancer. First and foremost, as parents, you go through a variety of emotions, ranging from anger, guilt, sadness. Guilt because, at that age, you're making most of the choices for your kid. And you feel that maybe it's something that you did wrong. Maybe you fed the kid something wrong. There was something wrong with the nutrition. And that has a very, very deep psychological impact. That had a deep impact on us. When we heard the news, obviously it was the worst part. And post that, every day was like a new hurdle. There was, post that, the surgery, which we had, which was the 4 longest hours of our lives, having the tumor removed. And we lost the kidney also because that's generally how you deal with a case where it is 9 centimeters. And post that, there was the pathology report coming in, which took us, which took 5 to 7 days, which is again the 5 longest days of my life, because then, there's the unfavorable, favorable histology, there's the staging, which was all very new to us. Thankfully, he was on a second stage, which made the treatment and the prognosis much better. Post that, we flew our son to Canada, to Toronto, to Sick Kids. It's one of the top pediatric hospitals. And there was, one of the main reasons that we did this is because we were trying to attend, apart from the physical aspect and the medical intervention, there's a psychological impact that all this has on us as a family unit and on our son. And we didn't want him to change in any way. That emotionally scars a kid. It definitely has emotionally scarred us. Kids can't talk about it. But that's something that we, I guess, lack in our country, is dealing with the psychological aspect of cancer. Talking about it, parents talking about it, trying to make the kid understand what the issue at hand is. Because it's extremely complex. When my son was flown in, obviously there was great care in Hinduja and he got the best treatment there. But there was still, because of the surgery, there was a psychological impact. And when he went there, his blood pressure shot up in the hospital in Canada. And they were equipped in dealing with that psychological aspect and calming him down. Ditto for us, because we also had someone to speak to through the entire incident. Another psychological impact was, we used to have nightmares. I came back to Bombay. I didn't get sleep. I was working here. I came back from my shoot after a month from there. I left my wife and my son. when he was being treated there. And I used to get all of 1 hour of sleep in the night, and it was hell for me. But that's something that I guess every parent has to deal with. And eventually, I don't even know if I need counseling after this. So I feel that India needs more units in hospitals. I think they are starting that right now. It's in the infancy. They have a field abroad which is psychosocial oncology, which deals with, attending to the counseling sessions for parents and for, even for youngsters. So it has had a deep psychological impact, something that I fully don't understand yet. I don't know the psychological impact that it's had. And as far as the cost goes, of course, my family could deal with it, but there is this huge problem, surmounting problem that you see in real India, in rural India. Because I've got so much of fan mail on Twitter and on my mail after the book was written, that generally the cases are, there's a late diagnosis, there's no awareness there, there's illiteracy, they don't understand what cancer is, there's social stigmas there. And when they find the cancer, it is so expensive that it's untreatable, and they can't do it at that income group. But now I believe there's metronomics, which has started off in India, which is again making it extremely approachable. A few hundred rupees for a treatment in an entire month, which is a paradigm shift, and I think it's really set the standard for India and the costing here. But yeah, costing is again a key issue for that income group, which needs to be attended to.
Yeah, definitely. I think psychological impact is something that we often discount as doctors. I mean, as doctors, we tend to concentrate on the disease. We tend to concentrate on curing the patient physically. So holistic care is something that is good apparatus as far as support is concerned. Setting up cancer care groups, and that is what we have replicated in Fortis Mulund. Dr. Badwe sir, do you think we should have more of these counselors?
Your burgers, your juices, all that is actually adding up. There are carcinogens out there. Who's going to inform people about all those things? So there's a lot of things that the system needs to put forth and say that these are harmful and this is cancerous. So that is not even there in our consciousness. That is not there in our awareness. Forget about in the rural areas. It's not there in education, educated sections in Mumbai. We don't know about it. After reading up everything, I've stopped sugar completely in my house. Because just like there was a ban on tobacco, very well soon enough, the next decade, you're going to know that sugar is one of the most toxic substances. I'd rather have a cigarette than have sugar, refined sugar. So these things need to come out in public domain, and people need to know about it, which people unfortunately don't know, and celebrities don't know. That's why they go ahead and probably promote a pop soda. I won't do that because I know what it does to the body. I know firsthand from my son's experience and after reading about all of this. So
that's really heartening to hear that.
Talking about sugar. Last year I had one symposium on sugar symposium for 3 hours. And that was a really revelation that how sugar is toxic, how it is only marketed, and only how you should only live on natural sugars. I mean, these are good sometimes opening your mind. Many of them you will not be able to follow them. But at least if you really know them, probably people will be more careful.
So only downside to this for all these female fans who have come here for Emraan is that you might not just see some Emraan films the way they used to be.
So, okay, we'll just go to the next question about Mr. Bhavti. A lot of things, Fortis has been in the forefront, especially about when you look about
feeling pinch. So if that's the kind of system available, yes, it wouldn't make any difference. The problem is that the cost of early detection, when extended to all cancers, can detect a lot more unnecessary cancers. If of lung cancer is diagnosed unnecessarily by screening, you have created a huge amount of business. And that's something which is not a business but needs to be run like one. The accountability, the QA/QC of all that remains exactly the same as any other business. But it is not a business that needs to be run like other business. If I am a car seller, if I am a telephone seller, that please have my phone. The end point of my existence in society as a doctor is zero disease in society. I cannot create unnecessary.
It will not necessarily make a huge difference in costs if we detect them at a particular point. But if the society can afford it, or if an individual can afford it, it still means that an early detection might save that person's financial as an individual level.
So it's again a very simple thing. That if there is a screening procedure that is known to save lives, then there is no cost implication, because you can't put a tag on somebody's life. So say cervical cancer screening, breast cancer screening with physical examination, maybe mammography after the age of 50, and oral examination. Other than these, there is no cancer. Colorectal cancer also is there, but kind of debatable. So there is no other cancer that can be treated.
The camps are really held like what Tata really does. But corporation definitely has now a policy of treating.
Well, first of all, I wish and hope there are more pediatric facilities here, because as far as when we had researched when my son was being treated, there's a dearth of pediatric doctors in India. Most of the kids are being treated by adult oncologists. So, and like Doctor said, there is a pediatric facility coming up in Mumbai and hopefully in other states and other cities, which is very imperative when it comes to treating little kids. And of course, healthcare systems are burdened. I hope there is some kind of provision made to give satisfactory measures, funding to those patients that come from small towns and to support them. The main cause over there for surmounting expenses, like I've heard, is late diagnosis, which when it reaches that stage, it becomes very hard for them to kind of pay up, and then they eventually drop out of treatment. And one thing that I also realized when I went abroad for the treatment of my son, there isn't much emphasis in the medical world on the lifestyle issues of cancer. Everyone is going down the approach of, you got a problem, pop a pill. We have to make sure we educate people and make them aware on how do you address the causative nature of cancer. Why does it happen in the first place? If it is a lifestyle issue, what can we do in our lives? And we've seen, I've spoken to so many doctors in Mumbai, kids are pouring in the last 2 decades, in the last decade. What are we doing? What has drastically gone wrong with the water we drink, with the food we eat, with the radiation levels? What is going wrong, and how do we address that? And the system needs to address that. So these are the things that have to be addressed by the medical world, so that at least you don't allow it to happen in the first place. Let's eradicate cancer and nip it in the bud. Instead of course, treatment options are very, very important, but let's make sure you at least bring in that awareness. Then, of course, if people know that smoking a cigarette will give them cancer and they choose to do it, then they're puffing the life away. But at least as far as kids go, there's the choice you make for them. So it's very important for parents also to kind of be educated, and for the government to do that.
Avinash sir, I think we'll have a small regarding the vision.
I think as Rajan said, if the federal support and the government support increases, I'm sure the infrastructure for this will definitely grow. Yes. Current 1.3% GDP has to go to at least 2 or 3. Then I'm sure all this will probably be better. Yeah. But I think I feel is what is important for is that there should be more awareness in the public about understanding a cancer and living with it and fighting against it.
From Dr. Badwe, he said, thought of. So I feel you can't find answers to questions your mind hasn't thought of. So the important thing is, have you asked the right questions? And I think we can do that. So I think you can do that. But I'm going back with a hope, because sir said that 60% of them are preventable. So I'm going back with a hope, and I'm sure that you have a hope too. Let's do our bit in it. And thank you once again. And now I would like to felicitate all of them. And I'm going to ask Dr. Anil Herur to kindly come forward and present a memento to Professor Dr. Rajendra Badwe. I'm going to ask Dr. Tejinder Singh to kindly, now presenting a memento to, I think the clap should continue. Thank you. Next, we would like to give a memento to Mr. Emraan Hashmi. I thought you would be whistling and hooting right now. Shouldn't you be doing that?
I would, one mention that I would do is Mr. Emraan Hashmi's book, The Kiss of Life, has become I would encourage everybody to go ahead, buy this book and read it. I have read it, done it myself, and it is really an eye-opener, and I would really applaud this cause of yours. Thank you.
We would now like to felicitate Mr. Manoj Nair. We would request our CEO, Mr. Bhavdeep Singh, to kindly felicitate both our moderators of the session.
Ladies and gentlemen, on the behalf of Fortis Hospital, Mulund, I thank all the esteemed panelists who have graced this event and shared with us their insights and opinion on burden of cancer. I mention our deep sense of appreciation for Dr. Badave for giving us an understanding into the reality of cancer burden.